Welcome to Emergency Insights. I'm your host, James Carter. Today, we're looking at a topic that is commonly misunderstood, the health risks associated with kissing infants. With us is an expert in pediatric infectious diseases, Dr. Erin Kimberly. Dr. Kimberly, thank you so much for joining us.
Thank you for having me, James. It's a pleasure to be here to discuss this important issue.
Dr. Kimberly, let's start with the basics. Kissing an infant is a natural expression of love. So what's the underlying danger here that we as healthcare providers need to understand and communicate?
The danger lies in a newborn's and young infant's extremely vulnerable immune system. Unlike an older child or adult, their immune system is underdeveloped and hasn't been exposed to most pathogens. A kiss from a seemingly healthy adult can transmit viruses and bacteria that are harmless to us, but can be life-threatening to a baby. We're talking about pathogens transferred through saliva and close contact.
Can you elaborate on some of the specific pathogens that can be transmitted through a kiss and the infections they can cause in an infant?
Absolutely. The most concerning are viruses from the herpes virus family, particularly Herpes Simplex Virus type 1, or HSV1, which causes cold sores. A kiss from someone with an active cold sore can lead to neonatal herpes, a devastating and potentially fatal infection, with a high mortality rate and long-term neurological complications in survivors. We also have to be mindful of respiratory syncytial virus, RSV, and influenza. While these might just cause a bad cold in an adult, in an infant, they can lead to severe bronchiolitis or pneumonia, often requiring hospitalization.
That's truly sobering. Beyond viruses, what about bacteria? Are there specific bacterial infections we should be worried about?
Yes, there are. Common bacteria like Streptococcus pneumoniae and Streptococcus pyogenes can be carried in the throats of healthy adults without causing any symptoms. However, if transmitted to an infant, they can cause severe infections like meningitis, which is inflammation of the membrane surrounding the brain and spinal cord, or sepsis, a life-threatening systemic response to infection. Another one to consider is Staphylococcus aureus, which can cause serious skin and systemic infections.
Given the serious nature of these infections, what are the key clinical signs that healthcare providers in a fast-paced environment like an emergency department should be looking for?
The challenge is that the signs can be very subtle and nonspecific. We need a high index of suspicion. Look for a febrile infant with lethargy, poor feeding, irritability, or any unusual skin lesions. For a febrile infant, especially one under 90 days, we should immediately ask about recent contact with anyone who has been sick. Specifically for neonatal herpes, we might see mucocutaneous vesicles, those telltale cold sore-like lesions, but they might not always be present.
How are these infections diagnosed and managed?
Diagnosis often relies on a combination of clinical suspicion and lab work. For viruses like HSV, we use PCR testing on cerebrospinal fluid, blood, or swabs. For respiratory viruses, PCR-based assays from a nasopharyngeal swab are the standard. Bacterial infections require immediate blood cultures and often a lumbar puncture to check the cerebrospinal fluid. As for management, it's about speed. For suspected neonatal herpes, we start intravenous acyclovir immediately. For bacterial infections, it's broad-spectrum intravenous antibiotics right away. Supportive care is crucial for all of them.
Finally, Dr. Kimberly, what is our role as healthcare professionals in preventing this? How do we effectively communicate this sensitive message to new parents and their families?
Our role is central and critical. We need to be proactive with public health education. We can start by normalizing the conversation. Explain the why. Their baby's immune system is still developing. I find that a simple mnemonic can be very effective. We can teach parents and families to think hands and no kisses. This phrase helps remind them to always wash their hands before touching the baby and to avoid kissing them, especially when they feel unwell. Also, we must advocate for and encourage caregivers to stay up to date on their vaccinations, including the flu shot and the new RSV vaccine. A moment of education can prevent a lifetime of devastating consequences.
That's an excellent takeaway. Dr. Kimberly, thank you so much for this invaluable and life-saving information.
My pleasure, James.